Hi, everyone. How's everyone doing tonight?
Right.
Thank you so much for coming and joining us tonight. We're really excited. It's our first seminar in almost a year, I think, or probably over a year. So I feel like we tried to, make it a little comfortable, not too close, but get the best chairs in the whole clinic. So, Tiffany, our nurse practitioner, many of you probably know, she's been here a couple years with us. She's actually going to start the seminar off tonight. So please give her a warm welcome, Tiffany Barber.
That was quick. We told Dr. Young earlier, I feel like the band that comes on before the actual band that came to see. So I'll be quick because he really does have a lot of things to talk about with the immune system, and I'm really excited to even hear what he has to say. So welcome. I don't think I've seen this many people in one place in a really long time. Are you not excited? Right? It's been a long time coming. And I talk with my hands, so this is gonna be like a balance in that too. You came for a show. Okay, so for an entire year since last January, it's really over a year, in this office, we have been doing a PRP, which is platelet-rich plasma, injection for women for urinary incontinence. So I don't know if you've seen all of our advertisements for this, the things we're putting out on Facebook through the newsletter. And so I wanted to give a little update on the things that I'm seeing with the patients that I have done this injection for. So usually, on the patient, we have a consultation, they come into my office and they say, oh my gosh, Tiffany, I can't take it anymore. I'm laughing, I'm crying, I'm sneezing, and I'm peeing at the same time. It's just terrible. And so we go through our options, right? There's all kinds of Western medicine drugs that we can take for bladder control. They work, they don't, And then I did a lot of research about a year and a half ago and found that this vaginal injection with the platelet-rich plasma, which comes from the patient, so it's nothing that's it is alternative, nothing artificial, it's not synthetic, and it actually gets in there and supports the connective tissues that hold the bladder in place, and also rejuvenates the nerves in that area so you have control of your urine. It's an amazing thing. And that's what I'm seeing is some amazing things. So we do the injection, the patient comes back in about 4 to 6 weeks, and I say, okay, tell me how it's going. And they said, from the moment I left your office, I no longer have urinary incontinence. Wow. And to me, like, I even have goosebumps now because it's so exciting to see my patients be well. And I always know that if you're my patient, in my office, I always say your success is my success, because without you saying that you feel better, that things have improved, that means nothing for me, and making sure that I get more patients coming in to do the same kind of treatment for their success as well. So we're seeing a lot of really great things with the PRP. Now I do PRP for achy joints, and I've done it for hair loss on the scalp. So we do a lot of things with this PRP, but this is the brand new thing that we started last year. And so we're seeing some great things with it. So I wanted to share that. Okay, now this is when I get to my notes. Because, right, this is the moment you've all been waiting for, is to talk about post-pandemic health, right? The big C word. So here's some things that I've been seeing in my office just with my patients post-pandemic. They may have a history of thyroid disorder. They may have a history of hormone imbalance, but they're coming in saying, Tiffany, we've made sure that my hormones are in check. We've made sure that my thyroid is working and all my numbers look great, but I still feel tired, or I'm still losing my hair, or my hair, skin, and nails look different. I'm not sleeping. All these things that are wrapped up in this nice bow that I'm going, but all your numbers look really good, right? So we have to start exploring some other issues that may be happening. And usually the case is, I ask them, have you been COVID? And they say, oh yeah, 3 months, or, oh yeah, I had it a year ago. And I'm going, okay, this may be some long COVID that's happening. And so I wrote down some things that I have been seeing. COVID. That we're trying to get a handle on here in the office. So a lot of that is hormone disruption. So they're having trouble sleeping. They're having hot flashes, even if they're on hormone replacement. My young patients are having irregular periods. They're having abdominal and pelvic pain. And of course, the hair, skin, and nails is not optimal. In a lot of patients, they're also saying that they're having a lot of weight gain for no reason. Tiffany, I haven't changed anything. I'm gaining weight like crazy. And I'm going, okay, tell me what you're eating, tell me what your activity level is, right? We're trying to get to the root cause of what's happening. And they really are. They eat clean, they're off the gluten, the dairy, the grains, the soy, and they're still gaining weight and they're frustrated. And that makes me frustrated as well. So they're gaining weight, they're just extremely tired. They can't regulate their temperature, they're hot, they're cold, they can't figure out which way they're going, up, down, sideways, no idea. And again, hair, skin, and nails, right? So at that point, I've looked at their hormones. Now we're looking at seeing, well, does this hit the thyroid really hard? Do I need to adjust medications, or do we need to start on any kind of thyroid medication to see if this would help? And then I'm seeing a lot of gut and liver health disruption. So, and I'm sure Dr. Young is seeing this too, where patients are coming in and they're like, I never had reflux before, and now I've got reflux and it's terrible. And gosh, I can't even lay down at night, and here it comes, whatever I ate for dinner, and it could be 3 hours later and you're still having that reflux come up, and it's really frustrating. So we're seeing a difference in gallbladder and bile duct function. So your liver enzymes are going to be elevated on your labs when you come in, and we're both going to look at each other and go, what the heck is this, right? And so we have to get down to the bottom of what's causing this. Was this COVID? Was this something that you ate? Is this something that's stress, right? That has a lot to do with our health as well. And then here's the $1 million thing. I read an article last week that said post-COVID, you then have a 40% increased risk for an autoimmune disorder. 40%, that's huge, huge. And we're talking about autoimmune disorders like Hashimoto's, right? So thyroiditis, rheumatoid arthritis. That's terrible, right? 40% risk just because I had COVID. Now I'm at risk for all these things. That's awful. I'm also seeing post-COVID patients come in and they're, explaining, oh, I'm so tired. This is terrible. Why do I feel this way? And we explore all these avenues and finally find out, while you had COVID, your immune system was busy trying to knock that COVID out. And here comes Epstein-Barr antibodies that have been dormant for 20, 30 years. And now they're rearing their ugly head. And now that your immune system has knocked the COVID down and you're healthy again, now that Epstein-Barr antibody level is so high that your immune system is not even able to do on its own, get those antibodies down. And so you're suffering with extreme fatigue, your hair's falling out, your skin looks terrible, your nails are brittle. And so we're finding a lot of patients that are having these disorders as well. So we're trying to fix that. So last thing I'm seeing post-COVID is patients that are having dysautonomias, and that's just a really, really fancy word. Welcome. Let's all stare at him one time. Dysautonomia. So it's really just a fancy word for the fact that my autonomic nervous system, which is the nervous system in charge of my blood pressure control, my pulse, is out of whack. Something disrupted the messages that my brain is sending for that to be under control. And so my patients come in and they're like, Tiff, all of a sudden I'm dizzy. I never was dizzy before. Or now when I stand up out of the chair, I feel like I'm going to fall over and I have to hold on to something to be able to stand upright. And so I'm going, oh boy, here we go. Right? How do we fix this? Well, again, that's another $1 million answer. So we have all kinds of treatment methods. So if you're my patient, you've been in my office, you know that any kind of approach to treatment is always a team approach, right? We talk about this. What's your budget? What do you want to do? Here are 3 or 4 treatment options. Which one do you think you want to hit first? If it was me, this is what I would do. If you were my mom, this is what I would want to do. If you're my sister, if you're my aunt, this is what I would tell you. So I'm very frank, and you know that I hit the bullet point hard by office. So we have treatments like exosome therapy in our office. If you saw Dr. Young and I's last podcast, you know we talked a little bit about this exosome therapy. What that does, they're specialized cells. They get into the body and they repair that messaging that's disrupted by COVID. So if it's the dysautonomias, right, that autonomic nervous system that's disrupted, and so your blood pressure is out of control, your pulse is out of control, you're getting dizzy, you're having balance issues, we can do that exosome therapy to repair that cellular messaging so that that gets right back to normal, right? Second option is we can treat each of these issues as a separate issue. If you have hormone issues post-COVID, then of course we want to make sure that your hormones are back on track. If you have thyroid issues post-COVID, we want to make sure that your thyroid is back on track. Same thing with the Epstein-Barr. Oh gosh, if that rears its ugly head, we got to make sure that we get that back on track as well. So being approached, right? Dr. Young operates the same way in his office. We go through our options, we go through what's best for you because everybody's a unique individual, right? Not everybody fits in the same box. So kind of exciting, right? In the bad way, but a good way. We're seeing some bad stuff, but boy, we're on it. We're really on it. So I can't wait. I see a lot of familiar faces, so I can't wait to see you in my office again. We'll talk about some of these things because gosh, even this week we're learning more things. And so as COVID just keeps roaring its ugly head, and then we learn more things as it goes. And sometimes you guys know more than we do about things, and we learn from each other. So it's an exciting thing. All right. Okay. See, I told you it's the small band before the big band. Here comes the big guy. So, so all of the things we just heard and talked about the immune system. He's gonna get down to the nitty gritty here, because he's already has his whiteboard ready. You're so tall. I even have my big shoes on today.
Job well done.
Thank you.
So I will just turn a little bit from COVID. So we first learned about the exosomes. It's a part of that cord blood. And no aborted fetuses or babies or whatever there. And a lady come in a few months ago, and hairdresser had gotten COVID and also gotten the COVID shot. She's bummed out. And she was a hairdresser because she just couldn't continue. Would stand for 5 minutes and after that just get a little woozy, blood pressure would drop. And so she just goes down to practice. So we saw her and there's no guarantee in medicine. But we did give her the exosomes. And just as they said in the studies, by 72 hours later, completely different woman. And back at work, very happy woman. Saw one the other day and it brought back a smell. Very happy. Loves his wife's cooking again. But there are some very interesting things you can do. And we're seeing more and more of that because COVID has just been rampant through that immune system, has just completely destroyed it. But there are things that you can do. Listen, I love to do the IV vitamin C. If you want to continue quercetin and zinc, ivermectin, since the pharmacies don't get you such a bad hassle now. Great. But probably the quickest thing we've seen works about 80–90% of the time is exosome. And so that's really been a lifesaver for a lot of people. Now, I was thinking how to start. All the time we're getting bombarded with these articles, you know, be youthful again, the Anti-Aging Medicine Society. If you can't be like Rudy, my IV nurse, who's 48, but looks like she's 17. We can't be tied, and the rest of us, you know, it's that idea of staying young. And you can do all kinds of creams and whatever you want. For the guys, you can take extra testosterone and be like a 16-year-old. I don't know if the wife always likes that, but there's all things you can do. And really, it's appearance-wise. But I think that if you're actually looking at really being young or having a system like when you were first born, it really, or, you know, as you got older, it is the immune system. So many things come out of the immune system. And a few years ago, an Australian group came out. They discovered a substance called substance P, like in the alphabet. This substance is the first step in the inflammatory process. You get a cold, you get an autoimmune disease. It starts as an inflammatory process. Any disease, any illness, not if you get hit by a truck. But really, most people die of some type of chronic disease. And substance P is the very first step. Now, the immune system really is what controls substance P. Or controls our illnesses. I was gonna make this a question and answer, but I already put it up here. So the immune system is made up of the thymus gland. Anybody know what the thymus gland is? What? Say it. All right, so it is a gland, it's in, yes, in chest, upper chest. As when you're born, it's rather large. As you get older, it gets smaller and smaller and smaller. But the thymus gland is where they make the T cells. The body makes T cells. We're gonna talk about that. Because you have T cells and B cells. Those are the main parts of the white blood cells that have to do with inflammation and infection. The skin, the largest organ in the immune system, secretes oils that have antibacterial properties, just acts as a protectant, does a number of things. The adenoids and tonsils, it drives me crazy when these ENT docs or hearing, my kids had 5 ear infections. They just decided to take out the adenoids and tonsils. He breathes better and that. What we do know is that part of the lymph system and people that get head and neck cancers who've had the tonsils or adenoids removed, they never do as well cancer-wise. Little thing to remember. And I find a lot of the adenoids and tonsil problems really are food allergies. Another part is the spleen here. It filters out the old blood cells, red and white. Also does make some white cells. The lymph system filters out, also has some antibacterial properties in it to destroy bacteria, viruses, cancer cells. The bone marrow, that's where you make the B cells. Talk about that in a second. And the appendix. I would hear people say, you really don't need the appendix. And being the Reformed Presbyterian that I am, creationist that I am, I never think that God was like designing it. Oh, I've got leftover material. Like me, and they putting a cabinet together. And, oh, Carl, these are just leftover screws. I'll just throw them away. Don't do that. Oh, shoot, I put it together wrong. And so, very interesting, because what they have discovered that just like with the adenoids and tonsils, if you've had your appendix removed, you get some type of GI cancer, you don't do as well because it's part of that lymph system. So a number of years ago in Finland, they did a study where they took people and they divided them up, came in with appendicitis, some got surgery, the other half just got antibiotics. Followed them. The ones that got surgery had no problems, some post-op problems or whatever. The other group, 90% of them had no more problems again. And it did reoccur several more times than they removed the appendix. So the US finally got brave enough. The Scandinavians also just have to take the lead. And so, I think it was in JAMA recently, we did a big study here. And basically it was the same results. 90% of the people that we just did the antibiotic therapy did not have to do surgery. Now, I can guarantee you, if you go to Morton Plant or St. Anthony's, right lower quadrant pain, high white count, not a pain, they're going to recommend surgery. Well, there's now enough evidence to say that may not be the best way. A number of years ago, it was in February, Rafa Nadal, and heavily into tennis, big tennis player, had appendicitis. And he's coming up on the French Open. And so he did not want to do surgery. They did give him antibiotics, and he did win the French Open. So take antibiotics and be a professional chest player. He did have surgery later. I found out. But the appendix is important because it also filters out cancer cells, bacteria, as a part of the immune system. Now, you get into a little nitty gritty. The white blood cells in our blood, you have white cells and red cells. The white cells are made up of the B and T cells. So the B cells make something called antibodies that the body makes to fight viruses, parasites, which the federal government in the US doesn't feel that Americans have parasites. The food's so clean.
Yeah, yeah, right.
Parasites,
Fertilizer.
cancer, any foreign body, a lot of that comes out of the B cells. Now, the B cells make these antibodies called IgG, IgM, IgE, IgA, immunoglobulin. I love this when people come in. I usually ask you what you had to eat, then because I'm always hungry and I can live off vicariously through you guys. So I had, and this is pretty typical. I'll have a 150-pound person come in, usually a female. John, I eat very healthy. I have one range-free egg in the morning. I have some a piece of Ezekiel toast. And I will have some kind of green drink. Okay, it's great. For lunch, I will have 4 ounces of range-free chicken. I will have some kale salad, organic, and some fresh, whatever, green drink. For dinner, I'm going to have 4 ounces of wild caught salmon and some what are they? Some kind of vegetable, broccoli, organic.
Very good.
And for dessert, I'll have 1 cube of dark chocolate.
Oh, yeah. Thumbs up.
All right, so you weigh 150 pounds. Okay, 1 egg is 8 grams of protein. Lunch, you have 4 ounces of chicken. Just because it's range free doesn't mean it's extra. There's 15 grams of protein. 4 ounces of fish is 15 grams. So you're getting, let's say, 40 grams of protein. You weigh 150 pounds. Divide 150 by 2.2 is about 7. You need 70 grams of protein. Yet a lot of people are coming in complaining, I notice I'm getting sick more often. Or, I just don't, my immune system's not as great. Because IgG, E, A, and M, they're all made of protein. John, I gotta get to Gainesville. Okay, here's a pint of gas. How far are you gonna get? And I say, you don't give me any protein to make an immune system. And I will tell you, I think 80% of the patients I see are low in protein. They get plenty of organic fruits and vegetables. And I love that. The minerals, the roughage. But if you have a car and you have the best Michelin tires, the best oil, the best nitrogen in the tires, but you put half kerosene and water and a gasoline mixture into the gas, you're going to go nowhere. And the protein aspect is a huge, huge problem for my patients. What is type 2 diabetes? Insulin resistance. What stops insulin? Protein. Now, I will tell you, all right, when I started my practice, I did have a little help. A guy named Bob worked for United Healthcare. And he said, John, I know you don't take insurance. What do we have to do to, we want you to work with United Healthcare, exclusive. I really wasn't into that much to insurance, but I said, okay. So he says, we've been watching you, and we noticed that with diabetes and hypertension, you can get about 80 to 90% of the patients off the medicine. That means that if you're getting them off their diabetic meds, probably less chance that they're going to have an amputation, which is going to save us money. Not going to kidney failure, which is going to save us a ton of money. So we would like to make your practice. So back when it was Ryan's on Alberton, the all-you-can-eat buffet, that's all you go there. So they would have 6 seminars a day. And I would he'd come out, all right, I'd get a phone call, excuse me, can I see him? Yeah, I'll be on in 14 minutes. Okay. Listen, let's just are you in a rush? Or I'll just say, I've got to do something real quick. I could get over there in 3.5 minutes. I'll give my 8-minute talk and get back. I did this for 6 weeks. I ended up, every time I talked, it usually was, I got 12 patients. I got almost 100 patients a day. And in 6 weeks, they made my practice. They cannot do that anymore. They found out it's illegal. But the thing was, diabetes and hypertension are big problems. The immune system, it all has to do with protein. Protein. I use something called a blood weight cocktail. I use a protein that's low heat made, and it's just basically the protein. Now, I get people coming in all the time, and because we live in America and it's hurry up and go. And so I bought these, well, Maria bought these. Premier Protein. My patients love this. Actually, it tastes pretty good. And if it's good, it's got to be good for you. 30 grams of protein, which is the most you can absorb at any one time. So I looked at the ingredients and I looked at carbohydrates. You take the number of carbs, divide it by 4, it will tell you how many teaspoons of sugar are in it. A can of Coke has about 48 carbs, or divide by 4, there's 12 teaspoons of sugar in that 12-ounce can of Coke. This has 5, which is not bad, so it's a little bit teaspoon of sugar, not bad. Then I'm reading what's in it. And the first thing I notice is sunflower seed oil, because it gives it a nice consistency. When you leave oil out at room temperature, what happens to it? Rancid. So how do you keep an oil from going rancid? Well, this has been sitting at the warehouse maybe for 6 weeks, and then sitting on the shelf at Walmart for another couple of weeks. So it's rancid. So you turn it into Crisco, which makes great pie crust. I'm going to tell you that. My mother did. So basically, it's a bunch of hydrogenated oil. Ensure. And they're now promoting it, in the sports world. All right. Let's see, what does this one have? This has corn syrup number 1. In some of the insurers, it's 54 carbs. So there's more sugar in this than in a can of Coke. But once again, there's the canola oil. So you're turning your cells into plastic. Oh, a lot of our patients use this protein, whey protein, love it. My little complaint is it's an isolate. It's not the full protein makeup. I want the whole protein, a concentrate. The other thing, once again, the Europeans learned how to ship oil. It's much easier to ship oil as a powder than as a liquid. So you can powderize an oil, but when you powderize an oil, you kill it. So when you're looking at oils, just look at the back of the package, and if it says any type of oil in it, you know it's hydrogenated. And then, I don't know, maybe because I had a lot of younger patients with the pebbles, Love this stuff. But once again, good taste. But hydrogenated oils in it. So, I like ours and all that, but when you're looking for proteins, you need to look at the label. And then, Tiffany, what is that little thing that you showed me today where you can,
Oh, the app?
yeah,
Oh, here, let me come
Come-
tell you.
yes.
Super excited. Really awesome. It's become the thing in my household. All right, so it's the Yuka app, Yuka. And you can scan, hold something up,
All right.
let me scan something.
Or do you
Give me
want,
that insure.
Ensure.
All right,
Um,
so I think the thing's on the bottom. You scan the barcode on the bottom and it comes up and it gives you a grade. So the grade is out of 100, right? You want to pass. That's always our test, right? So if it gives you a 49 out of 100, did you pass? Fail, right? So you click on there, it tells you, why did it fail? Oh, wait, it's got additives. You click on the additives, it says, oh golly, you've got 10 harmful additives in this
Wow.
thing that you're scanning. You click on it, more information on these additives. It will list every single additive that is harmful. And then you can click on that specific additive and it tells you, ready?
So, the magnesium phosphate. Love
So
that stuff.
excess phosphorus increases your risk of cardiovascular disease. It disrupts calcium metabolism and bone mineralization, right? That's important. Osteoporosis is a thing we all think about. So if this is going to disrupt your bone mineralization, that is not something that you want to put into your body. And it also negatively affects the kidneys,
Ooh,
right? That's one of the 10 additives in Ensure that's harmful to you.
wow.
So I love this thing. Now I'm scanning everything in the house.
Wow.
Scanned her husband, you have to sleep with him. So, when you're looking at, you want, keep it simple, stupid, as Uncle Glenn said, you stay with the big words, look out for oils, carb content needs to be low, probably 10 or less. You can only absorb 30 grams of protein at a time. Taking 2 shakes at a time, you've wasted it. And just, I don't mind some of the artificial sugars, I'll do some trade-offs, but you want a protein concentrate, not an isolate. And, I've wondered, with some of my patients on this stuff, I can never get their insulin levels down. And the other thing is, if you see maltodextrin in it,
Mm,
it makes diabetes worse.
wow.
So. All right. So you need the protein to make an immune system. All right. T cells. Now, what's very interesting about the T cells, because they really are kind of specific for cancer, is how many have heard of a treatment called CAR T? CAR-T. No one? You don't read Scientific American? All right. So a lot of the cancer treatments, they kind of maxed out the chemo aspect. Some of you are like, thank goodness. So they're going towards immune therapy, which I think is right. The immune system, when you're playing tennis 5 years ago, when that first breast cancer cell showed up, let's get it back to there where it should have knocked it out, it didn't. So CAR T is this. They draw your blood. They take the T cells and just grow them up, and it's like T cells on steroids. And they give them back to you, and they let them go after your cancer cells. Much, much less side effects. Now, what's interesting is Moffitt does do T-cell therapy. Unfortunately, you have to fail 2 rounds of chemo before they'll treat you. As one of my patients said, and he called me, John, because I mentioned it to him, and then he called me and someone will say, John, the second round did not do it. I talked to him, they're gonna give me T-cell therapy. And he died 4 days later. But that really is amazing because you're using the immune system to do what it should have. We can do it here, because we can draw the T cells, we can grow them up and all of that. But T cell CAR T really is your cutting edge cancer therapy now. Very, very interesting. Now, vitamin D, my favorite topic. It captures the antigens or the enemy, so the lymph system can deal with it. Vitamin D increases macrophages, which go after the viruses, all the bacteria. And it tells the T and B cells, come on, get over here and start attacking. Now, it is one of the things, and I know, sometimes I feel like giving up. Although enough doctors in town, I think, know me. Because one of the things is, I studied under Professor Holland at Harvard. Got to know him very well. Have a cell phone. We've done consults at 4:30 in the morning he's up at Harvard, I'm down here. And just a really, really great, easygoing guy. And Holly's the one that said, John, I'm on the board of the American Academy of Endocrinology. I've written the textbooks. I'm head of the Presidential Commission on Vitamin D. LabCorp, if they ever do a vitamin D level, they always mention me, M.F. Holland. I'm going to tell you, when we came to putting the levels of vitamin D down, we think about what it was. We decided that you didn't want to get rickets. How much vitamin D, nanograms per deciliter, did we need to prevent rickets? It was 30. Top number, there just was very little studies out there. There was one study out there. It was a poorly designed, poorly done study, but it did show that there seemed to be an increase in kidney stones. So we made 100 as our top level. They said, John, you need to ignore it. It is not true. And there's been a ton of studies since that has shown that vitamin D does not increase kidney stones. So before I do anything with you all, I tested on my family. That's why I got married to have kids. That's why we have 4 kids and not 1 and all that stuff. And I will say that the textbooks about when a girl can get married are wrong. You can get pregnant any time during those 30 days. I'm just telling you, not true. So Catherine, my youngest, is 12 years old, born Down syndrome, and all children said, listen, their immune systems are terrible. Because she's Downs, you call the clinic up, the first fever, pulling on the ears or whatever, we'll get her in that day and start her on antibiotics. Okay. And just expect, at least until she's 12, to probably be on antibiotics just probably every other month. Well, she's 12 and, oh shoot, no, she's never been on antibiotics. Now, her vitamin D level is 233. No kidney stones. I find that with my RA patients, if I keep that, rheumatoid arthritis, if I keep that level between 150 and 200, most of them just don't have that much bone pain. Because the vitamin D makes the immune system better. It makes those macrophages work better. Now, what's interesting is this. In 1903, a Dr. Fencer won the Nobel Prize in medicine because he discovered that you could take vitamin D and give it to people with leprosy and tuberculosis of the skin, and it wiped it out.
Wow.
Nothing ever happened about it because a few years later, antibiotics came out. So that was forgotten. And then in 2011, Michael Hollick discovered that the monocytes, which are part of those white cells, have their own vitamin D system in them. And I had a lady come in recently, and she says, I hadn't seen her for a couple years. She says, John, let me just say, we're back in town. We moved back here. You have saved me. 3 or 4 times a year, I would come home from work just feeling like the scratchy throat, I'm coming down with something. I would do the 40,000 units, little oranges before I went to bed. And the next morning, I'm fine. Because vitamin D jumpstarts the immune system. Very important part of this natural immunity. And when you're dealing with vitamin D, I will give you a little caveat, and I check for it, is 10% of middle-aged white women. Will they think I'm racist? Non-binary. You have to watch because vitamin D, if you get high doses, will elevate their calcium. So you have to watch out for that. So I usually check people I'm going to do high doses. I will get a 24-hour urine calcium, a parathyroid test. And if all that is fine, really the sky's the limit. And I know from Hollick's study and Capriers down in Brazil, of about 8,000 MS patients, dozens of 250 to 300, there is no MS. So it's hard to do in America because, even with me, it's because so many doctors are seeing my notes that it just makes it very, very difficult. Because I'm trying to operate between the board of medicine and all of that. But the studies are great. The other part of the immune system that I want to talk about, and then we're about done, is fevers. I read this in a nursing book, a nursing journal. And here's what it said, and I saw an article recently that just reaffirmed it. The immune system works best at what temperature? What temperature is the immune system like really killing those viruses and going after everything? 109? They did have a big one, 108. So it's between 102.5 and 104.5. That's when the immune system is working at its best. 102.5 to 104.5. But what are we telling everybody to do? Oh, 101, 101.5, or even 100, take Tylenol, take Advil, knock it down. The immune system is fighting its best between 102 and 104. And what we're doing is we're saying, no, don't put out the fire. Let's just, let it simmer there. And the only time you really get into trouble is people that have a history of seizures or where the temperature goes like from 100 to 102 in about 5 minutes, which happens with kids, or if you have brain injury, then the quick temperature change, you do get seizures. But for 99.9% of people, it doesn't happen. Slowly, gradually goes up. But it's interesting. We are doing so many things. And I even said at the hospital where I used to work, why are we always giving these kids with 101 or fever Tylenol? Well, it's our protocol. Well, you do know that the studies go against that. Yeah, but it's our protocol. Everything is protocol. So, just, I hope it's been helpful to you. You need protein, protein, and protein for the immune system. Vitamin D makes the immune system better. And if you do take my advice about before coming down with something, taking vitamin D, 40,000 units, liquid is much better. Just send $50 into me. So, because I'll have that as an office. All right, what do we do? Questions? I'm sure there's no questions.
Questions?